आज का टॉपिक है मेंस्ट्रुअल साइकिल। तो मेंस्ट्रुअल साइकिल में दो चेंजेस होती हैं, टू टाइप्स ऑफ चेंजेस आर देयर, ओवेरियन चेंजेस एंड यूट्राइन चेंजेस। ओवेरियन चेंजेस हैज टू phases, pre-ovulatory phase and luteal phase, whereas uterine changes has three phases, menstrual phase, proliferative phase and secretory phase. So now we are going to start with the ovarian changes. Ovarian changes, first phase is pre-ovulatory phase. As the name itself suggests, pre-ovulatory, ovulation before the ovulatory, like before the ovulation, the phase is known as pre-ovulatory phase. So what happens is the hypothalamus releases GRH, gonadotropin releasing hormone. That through that hormone, anterior pituitary is sent signal, and the anterior pituitary secretes FSH. FSH, follicle stimulating hormone, which helps the follicles to grow. That stimulates the growth of follicles. When the growth of follicles is there, some of the follicles may die and one follicle may mature to become a large Graafian follicle. And that large Graafian follicle, the leftover follicles secrete estrogen. And that estrogen increases the secretion of LH. LH is a hormone which helps in the ovulation. So that estrogen which was secreted by the follicles increases the secretion of LH. And that LH, what happens is, now follicles will rupture and one ovum is released, into the peritoneal cavity. Then luteal phase, the second phase of the ovarian changes is luteal phase. What happens is, it begins with the ovulation. Corpus luteum, corpus luteum is formed from the follicle cells that remain in the ovary after ovulation. Then corpus luteum secretes estrogen and progesterone. Corpus luteum secretes estrogen and progesterone during the remaining 12 to 14 days of the cycle, and that corpus luteum degenerates if the corpus luteum degenerates if it is not fertilized. The ovum is not fertilized, corpus luteum will degenerate. That degeneration of corpus luteum will decrease the estrogen and progesterone level, and then again anterior pituitary will get signal to secrete FSH and LH, and new reproductive cycle will be started. Now we are going to start with the uterine changes. So first is menstrual phase. What is menstrual phase? 4 to 6 days of the it consists of 4 to 6 days of bleeding, because the endometrium line which was formed is now breaking. Then due to that, FSH level will increase. FSH level will increase. And that will enable the beginning of the new cycle, and estrogen and progesterone level will decrease. Why it will as the estrogen and progesterone level are decreasing, that's why bleeding is coming. Then proliferative phase lasts for 9 days, and estrogen level are increased in this phase. Estrogen stimulate proliferation. So that's why estrogen level are increased. So estrogen stimulates proliferation and the growth of endometrium. Estrogen level is favoring the growth of endometrium. Then as estrogen increases, it suppresses the FSH and increases secretion of LH. Estrogen will increase, it will consequently result in FSH decrease. The FSH level will decrease and LH will increase. As I've told you, LH level will increase, it will stimulate ovulation and also formation of corpus luteum. Then ovulation usually results in 12 to 6 days, and progesterone level will decrease here. Estrogen level is increasing, progesterone level is decreasing. Estrogen level is increasing, that's why FSH is decreasing and LH is increasing. Then secretory phase, it lasts for 12 days and it follows ovulation. After that 12 days, ovulation will occur and LH level is increased. The Graafian follicle is replaced by corpus luteum. Progesterone is now preparing endometrium for the pregnancy, if fertilized egg or the ovum is implanted. So this is all about menstrual cycle.